coming in hot to give you our hot takes on all the latest mental health news.
From headlines and memes to developments and breakthroughs.
We go into this show blind with the hopes of learning something new.
Before sharing some bunny hugs.
And leaving with our eyes wide open. I'm Nick.
And I'm Todd. And this is Mental Health Headline Hot Takes.
We're glad you're here. Welcome, everyone. And we are going to determine who gets to decide, once again, if they want to go first or pass the baton. And are we going to do 2 out of 3 again, or do you want to just do one?
Maybe let's just do one.
All right.
We'll see how that goes. Rock,
paper, scissors. Winner gets to either go first or defer. Ready?
Yeah.
Rock, paper, scissors, shoot. And you beat me again. What you got. It was scissors.
Oh,
you beat me again.
I want you to go first this time.
Oh, okay.
You're a Cubs fan. No, not a Cubs fan. Well, you might be a Cubs fan.
I am a Cubs fan.
You're a Bears fan.
I'm a Bears fan.
So I'll
the Bears are
I feel
done.
Bad.
It's interesting because as we record this, it's probably, playoffs are going on. So yeah, we'll see.
Hopefully the Lions are still in it.
We can hope. So my story today is related to Chicago, which is where I'm from. And it's from a story on MedPage Today about public health policy. And it's called Overhauling Our Mental Health System with Eric Reinhardt, who's a medical doctor. And he discusses the need for Chicago's new program policy called Treatment Not Trauma. Now, this is...
I'm intrigued.
One of the big programs that our mayor, who's been mayor about 8 months now, Brandon Johnson, full disclosure, I worked on his campaign in Chicago. I met him and got to share, my thoughts about Chicago in general, but also told him one of my big reasons for choosing to support him was because of his Treatment Not Trauma program. And the reason for that is because crime is up in Chicago, which anybody around the world knows. Now, they'll tell you it's a war zone. It's not a war zone, but it's funny because people think they're going to just get shot walking off out of the grocery store or something. It's not like that. But
so more police in jails.
More police in jail. Right.
Gotcha.
And so he ran on the program of Treatment Not Trauma, and it was an initiative that's been years in the making in Chicago. Our last mayor talked about it, didn't do anything about it. And it's basically an agenda to build non-police crisis response systems in Chicago and reopen the 19 community the 19 community mental health care centers is what I meant to say. It's to open 19 of those because over the last 20 years or so, they closed 14 of them. And lo and behold, you watch the trends and guess what? Those close, crime goes up. Maybe it's a coinky-dink, but I don't know. So as I said, this was one of the big reasons that I supported Brandon Johnson. And basically, we have a system in this country where police are... I actually don't even want to get into police. We'll probably have... I don't even want to get into police. But basically, They're not trained in handling crises. They're trained in arresting people and using their guns. And when you have, people who have mental health challenges or mental health needs, according to this article, they're 16 times at a greater risk of being killed by the police. Okay. Mm-hmm. So you can see how this is super important to not just our mental wellness, but our overall community here in Chicago and the various communities within Chicago. So I think this program is incredibly powerful. I think it's a good start. I don't necessarily think that it just stops at opening up these 19 mental health service government facilities. Yeah, but it's a huge step in the right direction because we need non-police crisis responses. We need places where people can go when they need mental health support and also not have to worry about the financial burden, because a lot of the places where this crime and these violent crimes are happening and these crises are happening, they're in low income areas and people don't have access to basic human need resources, let alone mental health services. So I think this is I fully support this program. I think that if people need a place they can go when they're in crisis or they're struggling, ideally, hopefully before they're in crisis, they can find that connections and get the care that they need to preemptively stop some of these violent crimes that happen in the country, or in the city and the country, but in the city. So
You bleeding heart.
I'm a bleeding heart humanist. It's kind of controversial, apparently, but anyway, I support I support this movement. I believe that this is a long game, and I know we've talked about this before, but this is the long game, and there's already people I can already see the comments of how's your mayor doing? You supported this mayor. I get them all the time.
Oh.
It's like dude's been in office for 8 freaking months. He's not going to flip a switch and solve the city's problems, but he's taking the steps that he promised he was going to take, and it isn't going to happen overnight. And honestly, the campaign was well aware of this too. Like, they were well aware when they were running that, like, this stuff doesn't happen overnight. This is something that is very it's the long game, and it's an investment in people.
Yeah. And unfortunately, if he loses in a few years, that could all be scrapped, and you never see the
Exactly.
That's the thing that drives me cuckoo with governments is that kind of that shit. And I get it. I don't know how else you have a democracy without some of this stuff, but it's like,
well, people are
it's
impatient.
good and it's working. Don't cut that, please.
Yeah, and people are impatient.
Yeah, that's right. So the service that he's going to be providing or helping to provide, will they work in tandem with the police, or is it a whole other thing?
Yeah, so they will work in tandem with the police in a lot of the crisis situations. And actually, I found this out it had to be last spring. I met a candidate that was, or not a candidate, I'm sorry. I met someone who was outside of a Starbucks, and he's actually a crisis counselor that works with the police. So the police call him, and this is in a specific jurisdiction in Chicago. Right. Yeah. Okay. And they actually have crisis counselors that they can call. The police officers can call if they need them. But just seeing more of that, I think, is going to be really beneficial.
Yeah. A few years ago in my province, the cities started doing that. It's called PACT, P-A-C-T, and it stands for something police, something. And yeah, they have social workers and stuff go to some of these mental health check, welfare check things with them, or mental health crises. And because same thing, we're a little less gun happy here in Canada, but I'm assuming the statistics are very similar to yours, where it's without a crisis worker, people were going to jail or getting shot or getting roughed up or whatever. And I can attest, I was well taken care of in my suicide attempt. There was 2 or 3 police officers in my kitchen holding me down, and I was trying to reach for their gun, and there was a knife and all types of stuff. And there was no mental health worker there, but luckily I was taken care of. So that's good, but I was lucky. I was also a white middle-aged guy. And I don't want to sound woke, but the one cop that was in my kitchen whose gun I did woke. Grab. Well, I don't know. I'm in the gray area. But anyway, the guys whose gun I did grab, about 2 years after that happened, he was on Facebook making racial comments about Indigenous people. And so I truly believe if I was Indigenous, I would have gone to jail that day as opposed to the psych ward and getting help. But anyway.
Yeah, I fully, I could see that. It's, yeah.
So that's just a whole other reason to have like a non-police partisan person in there. That's mental health worker
Yeah.
that comes to crises.
Yeah, and that's the thing with like guns and stuff too. You just can't F around with the guns.
Yeah. And I mean, even when I was in the psych ward, there was security would be called once in a while. Anyone that's in a uniform that looks official and has a very nice haircut, they do not de-escalate things. Just having that person in view escalates things because, people, that's just human nature.
Yeah.
It's human nature. It's like, oh God, the cops are here. Now I'm really getting amped up. Whereas if someone's like, hey, I don't know what the social workers look like, but yeah, it is threatening when law and security come to your room or to your house and they're like, banging on your door. We want to make sure you're safe. It's like,
it's just so alarming. I mean,
so yeah, that's cool that you have a forward-thinking dude like that. Sorry, am I rambling?
He's probably the most progressive mayor. I mean, the system will probably eat him, chew him up, and spit him out. But you can just tell, and just from meeting him and stuff, his heart's in the right place. It's just whether or not he can follow through when everything's against him.
Right. Okay. You ready for mine?
All right, on to the next. Let's go.
Introducing the timely children's book, Sometimes Daddy Cries. The visually stunning book is told through the eyes of a boy whose father suffers from depression. He sees his dad get sad, rest, and even go to the hospital, all while comparing his father's depression to a physical ailment. Sometimes Daddy Cries is getting rave reviews from parents and mental health professionals alike. One critic has stated, "This is a timely and important book that will help countless fathers and sons broach the subject of depression." An Amazon customer commented, "An excellent book to open up a conversation with a young child about depression in a parent. No big words, just a book about feelings." Sometimes Daddy Cries author Todd Rennebaum has personal experiences with anxiety, depression, and addiction. Sometimes Daddy Cries is available in hardcover and paperback on Amazon.ca and Amazon.com.
Okay, this was in ScienceDaily.com, and again, I couldn't find the author of it, but it was a study out of University of Texas.
Sounds like
Austin.
It's more fake news.
It's fake news out of Texas. It's caregiving can be stressful, but it can also lower risk of depression. Becoming a caregiver to an aging parent or spouse can be stressful, but a new study is questioning the idea that family caregiving is also a risk factor of depression. The study published in the journal Advances in Life Course Research found that depression in adult caregivers is mostly driven by having a loved one experience serious health problems, while becoming a caregiver is associated with fewer symptoms of depression. So this assistant professor in the Department of Human Development and Family Sciences, who is the author of the paper, Sao Huang Han, I have no idea if I said that right, found that adult children become more depressed as their parents age, but there's no proof that actually becoming their caregiver is actually more depressing. So it's actually sorry, I'll keep going. This is a quote, rather I found that caregiving alleviated the extent to which adult children become depressed in response to their mother's health problems, suggesting that there may be something protective about being able to help others we care about. So actually, caring for people you love is not depressing, apparently. I mean, the depressing part is watching them age and deteriorate and stuff, but being there for them and being their caregiver and being able to have empathy for them and stuff, that's actually like, it almost like outweighs or counterbalances the grief of losing that parent in a way. He goes on to the stat was interesting. About 1 in 5 Americans are providing caregiving to an adult with health and functional needs, and about half of people over 50 are caregivers to older adults, which I didn't realize there was so many people caregiving other people.
Yeah, I didn't either. I mean, I guess I'm not surprised. It's just not something I'd think about.
Yeah, I'm thinking about it more because my parents are aging and my wife's parents are aging and going through some stuff. And it did talk a little bit about spouses, caregiving for spouses, and it was kind of the same results that, you know, he called it depressing watching them, age and stuff. I think that might be more grief than it is depression, but
I think they can, like, grief can cause situational depression, right?
Right. Yeah. Exactly. Yeah. But the giving back and the caregiving part, and knowing that you're able to help them, kind of alleviates some of the depression. Again, if you go probably poor people, it's different.
Well, my grandpa passed away, and this was a long time ago. I was in high school, and my grandma, she had some pretty bad arthritis, so she couldn't move like she used to. She couldn't do all the, especially the outside chores. Like, she would still clean and stuff, but she couldn't do the outside, the mowing the lawn, she would always find a way to weed, though, do her weeding and plant her roses. But she wasn't able to. So my dad, who was, we were working class, so he was renting an apartment. And when the lease was up, he moved in with my grandma to help just take care of the house and make sure she could keep it. And, over time, her health deteriorated physically. Mentally, she was pretty sharp still. And it became much more of a caregiving situation. And when I look back on that and I think, how it all went down, like, I feel like my dad gave up a lot of his life to do that. And I love my grandma. She was my favorite person in the whole wide world. But I do kind of feel for my dad, who was in his 40s, probably. 40s. And I can't imagine, like, I'm coming up on 40 in a couple of years. Like, I can't imagine having to take care of my parents at that age. Like, I have, you know what I mean? Like, such an added responsibility. And my dad was barely done with us, and now he's got to go to, help. So it is almost like I get all sides, and I do think it impacted him. And I do think he was, depressed from the whole situation, but at the same time would never, he would challenge her to, if you're not going to be able to do ABC, you have to go to a home. Right. Mm-hmm. And usually she would, it would push her because she didn't want to. And, there was stuff like that. But all in all, like, he gave up years and years of his life, in, potentially like prime years of his life, to take care of his mom. And it's like, where, is that fair? Is that right? Like, what is right? What's the line?
Yeah, I know. And I mean, it is situational too. Yeah. I mean, this is general speaking, but in the article, it did say it gives some people purpose, like some people that just, it is a very soul filling thing. But for people, like, I love my parents, but it would be hard for me to do it because I'm having a hard time just taking care of my goddamn self, let alone
I know, my
children. And then, put my life on pause to help them. And So, but yeah. And then you think of like places like Italy and France, where it's like multi-generations are living in the same house, and it's just they're all taking care of each other, and how lovely that is. And some of the more poorest countries in the world are actually some of the most content, because they do have.
But what's interesting too is, I think I've told you this before, maybe not. I worked for a company that was based in Sweden, so I spent a lot of time in Sweden. They actually have a very good system there, where when you get to a certain age and you can't live on your own anymore, there's like it's not like home. I don't know what it's like in Canada. Homes here are really depressing. Like, you get a small room, you get mashed potatoes, Salisbury steak on a good day. Like, it's not a pleasant place to be. And it's different in Sweden. Like, they actually have like housing and neighborhood and nurses that visit to do this stuff. But like, you still have sort of that autonomy of having your own space and still being in a community of other people who also need assisted living. So I think there's things we could do better, more in that model, while not
Yeah.
completely losing that like cohesiveness and that closeness that comes with the examples you shared.
Yeah. It'd be nice to combine those two somehow. And I mean, every culture is different, every country is different, every government's different. I mean, I as a Canadian, just viewing Americans, it's like, a lot of tax money goes to the military as opposed to, what do they call it, from crib to coffin, taken care of. And it's like, that's socialism and it's a dirty word and stuff. And here too, I mean, people,
We socialize the weapons manufacturers in this country.
Yeah, that's right. But here in Canada, there's private and government owned care homes, and it does sound like you get what you pay for.
Yeah.
The sad ones are generally, well, the cheap ones, and so the government run ones, and then other people are like, it's like a country club.
Yeah.
So, yeah.
So, once again, it comes down to class.
Hey, I'm classy, man. But I'm low class. Yeah. Well, I don't know. That was a shorter episode, but
yeah.
Hey.
How short was it? We weren't
no
talking
idea.
about like super depressing stuff today. That's why.
Yeah. That's all right. I mean, I not every episode is going to be 40 minutes or half hour or whatever. I don't know how long it is, but I think we talked about some good stuff and I had fun with my friend.
And that's what's important. Well, yeah. Thanks for bringing your article today. And I guess we'll be back here again next week.
Yes, be sure to follow Nick at all his links and me at all my links, Eyes Wide Open and Bunny Hugs and Mental Health and all that stuff. And be sure to, if there's a topic or an article you want us to check out, be sure to leave it in our DMs if you have it, or our comment section or whatever. And we'd love to hear from you.
And we'll see you next week.
See you, buddy.
Bye-bye. This has been our Mental Health Headline Hot Takes.
We're so glad you came.
Remember, when you heal yourself,
you heal the world.
Be sure to like this video, leave comments, and suggest articles for future episodes.
Hit subscribe to Eyes Wide Open
and Bunny Hugs and Mental Health.